Oh, we are live. Great. So good afternoon, everyone, or good morning and good evening for those that are in different time zones. We're really happy to host this IFMSA webinar on non-communicable diseases and the IFMSA strategic external goals. So we're happy to host this webinar as a part of a series of webinar around the IFMSA GEFAs, what we call, and we're also happy to have different speakers to talk about different areas around the NCDs, from the NCD global burden to the global action, and also to the youth activities that we are having in the upcoming period. So my name is Skander Essafi, for those who don't know me, and I'm the IFMSA Liaison Officer for Public Health Issues. And we will be going quickly around the outline and the speakers for today's webinar. So, in regards to the outline, we will be having up on the IFMSA Global External Focus Areas. That will be Marie's part. And then we'll be having Dr. Bente Mikkelsen, who is the World Health Organization Global Coordination Mechanism on NCDs head, who will be speaking about the global burden of NCDs, but also the global coordination mechanism around it. Then we'll be having Maria Jose Cisneros, who is the program coordinator on NCDs and healthy lifestyle for this term in IFMSA, to speak about the different activities that we are having. And hi, Maria, who just joined us. And then we'll be having Marie again to speak about the NCD Youth Caucus that we'll be having in the March meeting, so next month. And finally, this will be the sort of surprise we're having for this webinar, which is the NCD story campaign that we will be launching up until the March meeting. So we'll be heading quickly towards the presentation, and we'll be starting a bit about the recap on the global external focus areas for those who are not familiar with it. And we're having Marie to speak about it. So, Marie?
Okay, so probably some of you have heard about this several times before, but really the reasons why we have the global external focus areas this term is that in previous times, IFMSA didn't have much sort of strategic goals or any guidelines for where we would prioritize our efforts. And there was no common framework. So it was more from liaison officer to liaison officer, and depending on sometimes personal interests, a lot depending on what the different partners that we're working on, what they were working on, rather than IFMSA setting its own priorities and sort of figuring out where we think that we have a place in the world and where we think that we can have the biggest possible impact. So last term, there was a feel that there was a need for greater prioritization, but also a greater transparency towards the NMOs. So the NMOs also would have the ability to predict what IFMSA would be working on in external representation and maybe join efforts, and so that we could have a bigger work from the local, national, and to the global level, so there's more continuation. So really we had a process within the TO where we assessed what are people working on internally, but also with the liaison officers, and assessing what are our partners working on, what is the WHO working on, what's going on in the UN, but also some of the other partners that we work with, what are they very focused on. And then we came up with a proposal for these focus areas. And then we moved to consultations with the NMOs. And NMOs gave input, and there was, I think, one amendment in the end, and the framework was adopted at August meeting 2016 last year. So yeah, so as I said, it's based on both external factors but also internal factors, trying to figure out how can we get the most out of the work that we do, and where do we think medical students fit into to the world of global health. But now we're in this year, and it's meant to be for the adopted framework was for 1 year, and now we're in the implementation phase. So what we did with the liaison officers in the beginning of the term, actually before the beginning of the term, we sat down and we looked at what goals do we have under each GEFA, and what indicators, how can we see whether we're reaching our goals, and also looking into what actions do we need, who do we want to work with, what kind of campaigns or statements, or what kind of actions do we need to do to actually move towards this goal? It was important for us also to say that the GEFAs they do not limit us from working on other fields, but it's more as a guiding framework, so that whenever we receive an email or we receive an invitation for something, or we have to select what statements to make at the big meetings such as in WHO, we actually have something that can guide us towards saying yes or no, and also distributing funding and so on. So yeah, we hope you're liking it, and we're also now having this webinar series, and we're having it about non-communicable diseases because NCDs is also one of the GEFAs for this term. So I don't know if you can move to the next slide, Skander, then we can I'm not sure how it looks. Yeah, okay, sorry. I put in a picture. Yeah, so we have 10 global external focus areas, and here you see the 3 overarching concepts. So we have, and these overarching concepts are, so to say, things that we always think are important, no matter what is our topic or what area we're speaking about. We always think that these are important. So the overarching concepts are meaningful youth participation, sustainable health workforce, and health in all policies. So these are also always relevant to us. I think maybe you cannot see them, but the focus fields that we have, which are more sort of topic specific, they are humanitarian action, refugees and migrants' rights and health, non-communicable diseases, social accountability in medical schools, primary health care, climate change, and sexual reproductive health and rights. And you can also find a lot of information about this. We had a webinar only about the GEFAs where you could hear a little bit about each GEFA, and you can also find information about it in some of the material that we send out. So I think, yeah, sorry about the slides, but I think that's all from my side.
Thank you so much, Marie. I apologize also. I think there was a missing slide somewhere we can perhaps add later on. Thank you so much, and I hope that this gave a bit of overview before we move on more specifically towards the NCDs. And we're really honored to have Dr. Bente Mikkelsen to speak about the NCD global burden, but also the different actions that are being done at the global level. So Dr. Bente will be speaking about going from the basics around NCDs, but also about all the different processes and technicalities around how we deal with NCDs at the global level. Hello, Dr. Bente.
So thank you very much for the invitation, and sincerely congratulations to IFMSA having the courage and also the the priority on NCD. I think this is so pleasant for us. And also, we are very happy to learn that youth participation is so pronounced in your program. I think this is so important. We have been reaching out to youth organizations for a while, and we are very happy to have IFMSA as one of the participants of the global coordination mechanism. And this is really, really important. So thank you for the opportunity. And I was asked a kind of a broad background presentation, and of course it might be that I speak to people who knows absolutely everything I'm going to tell you now, but at least I will do this as a sort of a first step, and then hopefully there will be some time for questions and discussions as well. So I'm the head of the secretariat of something called the Global Coordination Mechanism on Non-Communicable Diseases, and we are placed in Geneva in the HQ of WHO, and was established in 2014 after 4 years of negotiations of our terms of reference in the World Health Assembly. I'm coming back to why we were established and what we are more specifically, but I will first take you through the more basic on non-communicable diseases. Together with me in the room is also Louise Agerschnapp, and she will also comment a little bit on the global communication campaign, and also if we are going to speak about the youth caucuses, we are both very much involved in that for the General Assembly coming up next month. Slide, please. Probably you know that. Are you shifting the slides, Skander?
Yes, it's loading.
Yes, it's loading.
It's loading. Okay. So. As you probably know, there is a huge political commitment to non-communicable diseases, and it started before 2011, but 2011 was a sort of a watershed event where the political declaration on non-communicable diseases was approved by heads of state and governments. And as you can see, probably from the slide, they all thought that really one of the biggest challenges on the 21st century was non-communicable diseases. Are you able to shift to the next slide?
Yeah. Yes, I just did.
Skander? You are, okay. Because I cannot see that. Is that...
See? Yes.
Okay, thank you. Yeah. I saw it for a moment, but not anymore, so I don't know. Well, I can look at my own slides, and then you shift on the.
Yes, I'm doing it.
Are you doing it? So if you go to the third slide, please.
Let me just. I think there's an issue. Just a second.
Okay, I just continue, and then we can find out which slide is important, because so the very basic is that we have as non-communicable diseases, there is of course a broad amount of diseases, but we focus on heart diseases, stroke, diabetes, cancer, and chronic lung diseases, because they together represent the biggest global burden of disease. And the thing that brings these diseases together is also the modifiable risk factors: tobacco use, unhealthy diets, physical inactivity, and harmful use of tobacco. And I don't know if you see the next slide, but the next slide shows us that there is a huge amount of people dying too young. So we are speaking about premature mortality, meaning that people dies between 30 years of age and 70 years of age. And the big aim for the global action plan on NCD is that we want to reduce premature mortality before 2025 by 25%. And during the years, WHO has developed a huge set of tools which make this possible. And if the governments really start using these tools, we believe that it is possible to reach this target. On the next slide, you can see, if you can see, is the slides working now, Skander?
Yes, it is, but I'm just trying to put the full screen, but it seems that it's people can see it.
Okay. So on the next slide, you can see the WHO Global Monitoring Framework on NCDs, and I was asked to comment on the Global Action Plan. And I will be very happy to, as part of the presentation, also provide some links to the audience after the presentation, because it's very easy to find material around this on WHO websites. So one thing is that we have an NCD tool webpage, which brings you to tools that can help countries to reduce risk factors that focus on cancer, diabetes, and so on, but also more general tools on policy development, research, and so forth. And you can see on these slides that we have 9 targets, 9 global targets, and these are voluntary targets. And it is, among other things, 30% relative reduction in prevalence of current tobacco use. And we have halt in the rise in diabetes and obesity, 30% relative reduction in mean population intake of salt and sodium, and so on. And in this global monitoring framework, we also have 26 indicators, and we are going to track on the targets and on the indicators several times to the UN General Assembly, but also, of course, to the World Health Assembly. In addition to these targets, we have also a set of progress indicators, which we already have reported on once, and we are about to collect information for the second report that will happen in 2018 in New York during the UN high-level meeting on NCD. And what these monitorings shows us is that even if we have a huge political commitment and we have the tools in place, we still see that the progress is uneven, and we can still see that for many politicians, the reality around NCDs is hidden and misunderstood. So whatever we do, we see that there is a huge need for advocacy still. There is a huge need for health education, both for on an institutional level and also on health literacy to the population. And we try to accommodate for this through our global communication campaign and a lot of other initiatives from WHO. On the next slide, you can see something you know very well, I guess, and that's the Sustainable Development Goals. And of course, you can imagine that we put the third goal, namely the good health and well-being goal, in the center of the 17 goals. But saying that, I think we all understand that all these goals are interlinked, and it's and interconnected, and also in a sense indivisible. So we know that the future for global health is very much sort of an integrated approach, and especially around NCD, the case is that we believe that only 1/3 of the interventions is possible to do within the health sector, while most of the interventions needs to be beyond the health sector. So meaning we need to take into account how do we plan our cities? Is there bike lanes? How do the pollution development actually happen? What do we do around air pollution? We also know that we need to apply a gender and a human rights perspective, and so on and so forth. So on the next slide, you can see the more in detail the targets within the health goal 3, and especially target 3.4, as you can see, is completely aligned with the NCD agenda, saying that by 2030 we have to reduce by 1/3 the premature mortality for NCD through the prevention and treatment and promote mental health and well-being. So this is really our goal for the future. So I'm now moving on to what the global coordination mechanism is about, and hopefully also how you can see yourself as a participant, and what are the asks that we ask from you and from other participants. So as I mentioned in the beginning, the member states used many years to agree on the terms of reference, and one of the main reasons for that was that the member states knew that everybody has to join forces to be able to tackle NCD, both to do prevention and also to manage NCD, meaning that we need to include all the UN agencies, the academic sector, but also the private sector. So there was a huge discussion on how could we do this, who could host it, who could lead it, and so on. And in the end, it was decided that this should be done by WHO, hosted by WHO, and the scope and purpose is very ambitious. It is really to facilitate and enhance the coordination of activities, multi-stakeholder engagement and action across sectors on all levels, from local, national, regional and global level. And today, 2.5 years after the establishment, we can see there is a huge request from member states and countries on how to actually create multi-stakeholder mechanism, also called hollow society and hollow governments mechanism at the national level, to bring all these partners together. So the member states decided that we should have 5 functions. We should do advocacy and raising awareness, which we do through our global communication campaign, but also through many other different measures. For for example, the dialogues. We are about to plan our 4th dialogue, which will be about policy coherence. But the 3 first one was about development poverty, international cooperation, and the last one in Mauritius last year was about how to engage with the private sector. So you can see that what we are doing is not especially any technical area, but it's really sort of the mechanisms and the need for cooperation between different programmatic areas, between different sectors, and also then bringing everybody together around the table to discuss. We are also doing dissemination of knowledge and information. So like you do now, we do webinars, we have a global portal, and this is under development, but we really hope that this can be one of the more important knowledge hubs for the future, bringing together all the material that actually can help member states to implement the measures for NCD. And also we are very much focused on sort of unblocking barriers and seek innovative solutions. So the dialogues, for example, always come out with a report with recommendations. We also run working groups with very specific topics on how governments can follow up on their own commitments and make this happen in their own countries. And these working groups are also coming up with recommendations on NCD and financing, on how to work with the private sector, how to align international cooperation with national plans. And the current one, which we also have 2 special advisors as from the youth communities, is about health literacy and health education. So we are trying to advance multi-sectoral action. We are also advocating for mobilization of resources. And how we do this is, of course, most important to really attract the most important organizations like your own. And at the moment we have 327 participants, all the member states, of course, most of the UN agencies, to every woman, every child. Also, we are reaching out to the NGOs working on environment, climate, also on from the UN Habitat, from the city development, and so on. So I mentioned already the dialogues, the working groups, and we will come back a little bit to the global communication campaign. And you yourself are very active in the first virtual discussion forum that we did last year, and we are planning to do more of those in the future. And we are also now setting up communities of practice, and we are really looking forward to a community of practice of youth, which we will hopefully be able to launch in Montenegro. And we are doing newsletters, and I will tell you a little bit about integrated support as well. So the next slide is just to answer a question: what is the next step for the NCD agenda? And of course, what we are doing now, I think all of us in the NCD family, is getting ready for 2018. 2018 is a new milestone for us. So we are going to report back to the UN General Assembly in 2018. So during 2017, meaning this year, the Director General will deliver her report to the Secretary General of the UN about the progress on NCD. And to be well prepared for this, we will do a lot of different activities. For example, there will be regional meetings in all the 6 WHO regions. We will hopefully be able to provide important information and solution through many of the meetings happening during 2017 and early 2018. So this is a very important year for us, and it's of course also beyond the reporting back. I mean, the real thing is the urgency to tackle NCD. We can see that more and more countries are using too much money on managing diseases that could be prevented, and this is really the task that we are up to, and we need all the sort of the support that we can get, and we need to prepare our health workforces to be able to tackle NCD. The next slide is a little bit busy, but it's trying to sort of pull together everything that is provided in the global architecture that sort of helps us to reach the targets in 2025 and 2030. And I think the most important in this slide is the sort of the middle column, saying that there is some priorities decided in 2014 by the governments, and that is that they will put in place governance for NCD. They will implement the measures to tackle the risk factors. They will work on improvement in their health systems, and they will do surveillance as well. And this will all of it help very well. And maybe the most important first step is that the government set national targets on NCD, and they are also setting up monitoring systems to be able to monitor the progress. So to end up my presentation, I think a kind of a simplified list, if you move 2 slides forward, is that we really need your help and everybody's help to raise the level of the advocacy and awareness. We need to help our governments to explain the real need that is existing in the area of NCD, and maybe we need to translate that into financial implications, because we can see that the cost of inaction on the area of non-communicable diseases is actually threatening the health budgets, but also actually the budgets of the countries. This needs to be proven, and this needs to be clear to all the actors. We need to make the national plans functional. They should be prioritized, they should be budgeted. We need multi-stakeholder mechanisms to be set in place, and of course nothing will happen if we are not able to monitor and survey the progress in every country. And now with the new sustainable development goals, we need NCD to be one of the main priorities for the new national SDG plans in countries. And we believe that to be able to achieve all of this, we also need very strong civil societies in countries. And I could add also that universities that actually are training medical personnel, being it doctors or midwives or nurses or what could it be, really prepare our healthcare personnel to act multi-sectoral, to act also for prevention, not only for management. And I'm very curious on your opinions on this, and also the outcome of some of the working groups during your General Assembly in Montenegro. So I think I will end up with a picture about the global communication campaign, if you can click towards that, Skander. And maybe Louise can have a couple of minutes to tell you something about that.
So,
do you want me to?
Yes. Hi, everybody. Do you have the slide that refers to the campaign? Is that coming up? Here it is. Okay, good. So the GCM has been mandated to launch a global communications campaign that, and the wording goes as follows, that demonstrates the feasibility of for governments to achieve the 9 global targets on NCDs by 2025. So the concept of feasibility is very central. But having looked more at this, we also believe that the word relevance and importance is something that we need to stress, given that feasibility is not the only barrier, with sort of the perception of this being difficult or governments not knowing exactly how to proceed is one barrier, but another one is perhaps that some sectors of government have yet to fully see how NCDs relate to trade, to finance, to education, and so forth. So the overall objective of the campaign is to inspire governments to take action. So this is what the campaign wants to do. It wants to show governments that this is feasible, and it wants to make them excited about it and have them start taking action to close the gap between the commitments they have made and the actions taken so far. And these are we're still panning out how this is going to look in practice. But as it stands, it looks like some of the deliverables of the campaign will be advocacy material that we equip governments with, so that they can demonstrate, as I said, the relevance of NCDs to different development areas. So key messages or infographics, videos, stories of countries that are champions in the area, and showing how NCDs are closely linked to trade and globalization, how NCDs are also driven by levels of education and health literacy, how this is also something that finance ministers should take into account, because we know that NCDs are undermining the economies and development gains in most countries. And you can ask, so what would success look like? For us, I think success would look would be expressed in having governments, and not only ministries of health, but other sectors of government, acknowledging NCDs at big meetings like the high-level political forum that will take place in July, and will be focusing on sustainable development, the Sustainable Development Goals. And there are about 40 governments that have volunteered to come forward as sort of the first to demonstrate their progress. If we could have them actually talk about NCDs as something that's central, that would be a huge gain. Another thing is to have other development forum for us, such as World Bank meetings or ASEAN meetings, have sessions on NCDs, so that you begin bringing NCDs into the narrative of other development actors. So really breaking out of the health silo, I think this is very much what the campaign is about. And as a component of the campaign, we have two websites. One is on the WHO corporate website, and you'll see the two links on the slide. So it's called Beat NCDs, and this is a site we'll be developing much more going forward with these advocacy materials for governments, stories of champions, countries that take the lead and are really making a difference in this area. And the other one is something that you will get much more familiar with at your upcoming General Assembly. It's called NCDs and Me. And it's placed on a different platform, which is part of the GCM web portal. And it's a place where anyone from all walks of life can come and tell his or her story about how NCDs and their risk factors affect us. And you will see on the first page, when you go there, we will have a photo booth at, or you will have a photo booth at the IFMSA General Assembly, and Maria has kindly offered to facilitate that. And in that photo booth, there'll be a computer, and you can log into this page, and you can select the different options from how NCDs affect you. It could be either in your own body, maybe you've experienced having diabetes or other NCD conditions. It could also be that, very likely be that people in your circle of families and friends have had cancer, cardiovascular disease, stroke, and so forth. I think it's also important to include how we are affected by risk factors. I personally am a bit sort of annoyed at the fact that there are adults smoking outside my kids' school. I mean, these are things that show that NCDs and the risk factors, they're all around us. I see my children being bombarded with advertising for unhealthy food and so on. I think we need to start putting words on that and saying, this is in my environment and I don't like it, I want to act on it. So apart from all sort of the negative ways that we are affected, there's also a possibility of choosing the option of, you know, I promote health, I promote physical activity and healthy food and so on, or I promote social innovation for NCDs, or I'm a health worker. So there are many ways that we are part of this NCDs and Me movement. So when you click on those options, you'll get to a new page, and in the end, you'll get to a page where you can tell your own story, upload a photo. So this is what we hope all of the IFMSA delegates will do, because we need to put also youth voices to this and medical students' voices to why this is not a bigger part of your training as doctors, what you want to learn about this, and how you would like to be equipped in order to address this global epidemic going forward and in your future careers. So I really hope you'll join the campaign, and you can see in there already now there are many very moving stories and we need to really bring it out to the world. And one last point I want to say, that this is also about reducing misperceptions about the diseases and stigma. When we talk to people from the global south, it's clear that having cancer is not something that, as in the global north, will trigger empathy and care and treatment. It's something that people feel guilty about, and they keep to themselves, and they die without ever being treated or having a support system. And if they in the case of treatment or dying, there's often no palliative care. So these are things we need to address, and we need to speak to it. So please join it.
So thank you. We probably used too much time, so apologies for that. But thank you so much for the opportunity.
Thank you so much, Bente, Luisa. It was really inspiring to have you speaking on this, and also mention IFMSA at several occasions where we can both collaborate and also use this message to build strong forces together.
Thank you.
Thank you so much. So we'll be moving forward with the presentation. But just a quick reminder to our audience that you can follow the webinar either now or afterwards if you are unable to join, but also ask questions or leave comments on the YouTube video, or also on our Facebook event, and we'll be able to respond to your questions after the full presentation. So we will keep going, and sorry for the small technical difficulties, so we'll be able to adjust accordingly later on. So we will keep going with the next point, which is actually a bit of my part. Since we actually covered both the basics around NCDs and NCD action, but also the link with IFMSA's involvement in terms of youth action and how this tells to our work as IFMSA. And this is where, just wait a second, this is where we are thinking that non-communicable diseases should be considered as a priority in IFMSA, seeing that there's a need for multi-sectorial action and country implementation where youth and medical students have a role in it. And we are considering through this global external goal that IFMSA should be considered as a youth-led organization in addressing NCDs. And this should be considered throughout several areas where we think, for example, that there's still a need to raise our voice when it comes to advocacy in tobacco control. We've been, for example, involved in the Conference of Parties around the WHO Framework Convention on Tobacco Control, where we had an IFMSA delegation, and we tried to make our voice heard and build up a stance when it comes to several measures or policies that still need to be implemented. We also focus a lot on mental health and the need to address mental health, especially within vulnerable groups, and we consider that youth and medical students are among one of them. It is also around sugar policy and the obesogenic environment that we need to address. And we've been involved in several conferences, and we think that there are several opportunities where we can get involved, not also by but also by showcasing our role and our activities, and we will be able to talk more about it with Maria about the different activities that are being organized, so that we can bridge this link between our internal and local action, but also our global impact and the role we have at the external level. And finally, we'll be speaking later about the NCD Youth Caucus as part of the NCD Global External Focus area, since we believe that this will further increase our role and our efforts towards having a stronger stance on NCDs. So we'll move forward to the Non-Communicable Diseases and Healthy Lifestyle program, together with Maria. So Maria, you have the floor to tell us more about the program and the different activities that are being organized.
All right. So thanks, Skander. It's good to be here. Let's talk a little bit about the NCDs and Healthy Lifestyles program. So it's important for us to remember how we started. Well, in IFMSA, we felt the need to have this as a program based on the 2014-2015 report, where we find the conclusions that many national member organizations were spending time and efforts to combat NCDs and promote healthier lifestyles to medical students and general populations. But sadly, the advocacy tools lack methodologies, so the outcome, it was really immeasurable. So it was complicated for us to assess if their activities were successful or not. So the program was proposed during the August meeting in 2015 and adopted then as well. And since then, we have been working on this program that is focused mainly on diabetes, cancer, cardiovascular disease, respiratory diseases, and the major risk factors like unhealthy diets, physical inactivity, tobacco use, and excessive alcohol use as well. Skander, next slide, please. Thank you. So let's talk a little bit more about impact. So in 2015, 2016, we had 20 activities enrolled and reported. From them, there were only from 10 NMOs. And the main regions that are currently working on it were the Americas, Asia Pacific, and Europe. From these 20 NMOs, 13 were under the NCDs umbrella, covering diabetes, cancer, cardiovascular disease, and others. And based on the report, we conclude that 6,741 people were reached and 99 medical students were beneficiaries. And from those 20 same activities enrolled, 7 of them were under the Healthy Lifestyles umbrella. And based on the reports, we conclude that 2,885 people were reached and 393 medical students were beneficiaries as well. So far, 2016, 2017. Next slide, Skander, please. Skander. Okay, thank you. So far in our team, we have 8 enrolled activities, all of them from 8 different countries. We still have, we're still pending the final report from some of those activities. So we don't really have numbers to show yet, but we do have names. So far we have the Netherlands, Tunisia, Iraq, Bangladesh, India, Burkina Faso, Kyrgyzstan, and Ecuador as one of the countries that are currently working on it. And we want to talk to you a bit about the activities that we are doing as a global community. So here are 2 examples. The next slide, please, Skander. The first one is from IFMSA, the Netherlands, and it's called Students for a Healthy Lifestyle. This was a national campaign, and what it's really important is that the main target was childhood obesity. So it was important because in this activity, the main goal was to teach both the primary school children and their parents about healthier lifestyles. So it's really relevant for us since it's targeting an often forgotten sector, as we said before, and it's important for us to work more on it. And the other example is the one from IFMSA Iraq called United Against Diabetes. This was a national campaign as well. And the target group was the elderly people. So the aim was to teach them more about their condition and work on the prevention of secondary diabetes complications. So it's important on both to remember that before the main activities, there was preparation and education to the medical students so they can interact with the target groups in a really efficient way. So this is what we are doing globally, but of course we want to know more about what you are doing in your own countries. And don't forget that you can enroll your activities. Just contact me. I will try to give you my email after the webinar. But yes, that is what we are trying to do. As said before, we believe that youth is a main part of the change. And here we are talking about something really problematic, that is NCDs. So it's up to us to fight it. And I guess that is it from my side. Skander?
Yes. Thank you so much, Maria, for your presentation and for covering also the different activities, but also the potential that we have to further enroll our activities and also assess the impact that we can have as a federation. And we'll move also now to Marie to speak about the NCD Youth Caucus.
Thank you. I also want to thank Maria for giving an outline of the program, and I think it's really important that you all consider enrolling your activities. I'm sure there's lots more, and this is really something that you can benefit from by enrolling, but also maybe we in external representation will be able to get the word out about your activities, also when we talk to people from your own countries and so on. So I really think we can help each other out if we engage even more in the program. So thank you for having that part as well, Skander. Moving on to the NCD Youth Caucus, which is something I've been working on with Bente and Louise and other employees at the WHO Non-Communicable Disease and Global Coordination Mechanism throughout the past many months, actually. Yeah, thank you, Skander. And what the outline that we have for now is that we've already collected the data, and there we have information from the NMO president from each of 126 NMOs from all around the world, clearly. So we have had 3 questions, and really they are sort of building the case and making sure that we have information from IFMSA that we use in this NCD Youth Caucus. And what we can see, maybe now I can give you a bit of a sneak peek, and what the data suggests is that there is a big need for a larger focus on upstream factors to NCDs. Many NMOs said that there was a bigger need for that in their curriculum, and also surprisingly, actually quite a lot of NMOs said that they think there's too small a focus on prevention of NCDs in their curriculum, which is in my opinion, something that should be in any medical curriculum, and prevention of NCDs should be definitely something that doctors were aware of and taught. So this is something that we will also discuss during the event in March meeting, where we are lucky enough to have Bente with us as well. So Bente will give a keynote, and you'll also hear her speak in the opening ceremony. And then we'll have 2 sessions in parallel to the theme event, which is organized by the organizing committee. And there we'll have one panel focusing more on the global burden of disease, where we'll talk about access to medicines, diagnostics, and other technologies. We'll talk also about financing for NCDs, and really kind of see if we as civil society can build a call for an investment case in NCDs, and really saying, passing on to member states how the returns of investing in NCDs are actually really large. So I think that will also be a focus for us. And then we'll focus on nutrition and also urban planning and the environment, and how those factors also affect NCDs. I think we might also discuss a little bit how we can use some of the existing institutions that we have already, such as clinics for sexual reproductive health, things traditionally, how they can also be used in reaching universal health coverage and greater access to medicines and diagnostics for NCDs. So those are some of the things that we'll discuss in the first session. Here we'll have some panelists, and then afterwards, after the panelists have spoken and you've asked questions, then we'll divide into smaller groups where we will work on and see what you as medical students think would be the best solutions for you in your context, because we really think that that can build a strong declaration. We kind of want to build this movement both at the national level and the international level as well, for young people to get engaged. And I think it's important that we, our generation, does take responsibility to fight this battle and fight the NCDs. And then the second session will be sort of more focused on us as medical students and our profession. So we'll look into more focusing on some of the data that I talked about before, but what the role of doctors are in society, and also as advocates for NCDs, but also as working physicians in the hospitals and as a GP, what are our responsibilities in the fight against NCDs. And then, as Louisa mentioned, it's not on the slides, but as Louisa mentioned, we will be having this photo booth where you can all upload your own NCD stories, or how it relates to you, or how it relates to someone who's close to you. And really, it would be so cool if we could have a lot of young faces up on this campaign. So I hope you'll all join us in that. And then, of course, it's not a random time, and it's not a random topic that we're picking NCDs now. We're picking it because it's important and it's a great threat to global health, but we're also picking it because, and working on it right now, because of the high-level meeting at the United Nations about NCDs in 2018, which Bente also talked about, where I hope that we can adopt the declaration in Budva about our call, and a youth declaration for action on NCDs. And there, from that youth declaration, we can really take on some key messages that we want to pass on and that we want to use for advocacy. And this can be used, we definitely plan on using it as a team of officials, but it can also be used at any level of society as well. So I hope we can have a strong declaration there, and that can help us in the negotiation and the lobbying and the talks that we have with different stakeholders. So yeah, I think that is all sort of a brief summary of what we're planning with the NCD Youth Caucus. Thank you, Skander.
Thank you, Marie, for outlining the program for the March meeting, and we hope to have as many members that are engaged in this program as you've seen. We're planning to make it as much dynamic and engaging as possible, and we're also happy to have a lot of support from the WHO NCD GCM, so that we see how much we can achieve, and also sort of bridge the gap in the different collaborations that we are doing. And this is where we are launching this campaign. As you can see, is that seeing that the campaign that is organized by the WHO and the way we want to adapt it to our own federation, we would like to make it as much easy as possible in 3 steps on how to further engage in this campaign. Is that we through this webinar, we wanted to raise as much awareness as possible on NCD action. So there are several ways that, to make it possible, whether that you can do activities or try to get engaged in several campaigns or conferences. But then again, within this campaign, you can easily get involved by just taking a picture or write a text on your own involvement, or how much NCDs can speak to you. So we can start by personal stories, as Louisa kindly mentioned, and we can further try to implement it within our own federation. And finally, you can submit this personal story at the WHO website. You've seen the website or the link that Louisa mentioned, and we will be sharing this poster later on. But also you can also share it with us, so that we can try to showcase it at the photo booth, showing the different stories that come from our members. So we would like to have a primary or preliminary deadline within us as the 25th of February. But then you can also submit at any time your stories up until the March meeting, so that we can showcase it, and hopefully try to find a link between your involvement in NCD action or NCDs personally, and also what we can further do up until the March meeting and beyond. I don't know if Marie, if you have something to add in regards to that, into the photo booth.
No, I think it's been covered. Thanks.
Yeah, great. So we'll be further sharing this poster and also further details on how you can be involved. And I think I'll leave it up to the audience if there are any questions, but also if any of the panelists or speakers would like to share thoughts or questions to others, will be very welcome. Just a reminder that you can still ask questions and leave comments on the YouTube video or on the Facebook event. So we'll be giving a couple of minutes, but until then, are there any questions or further comments that you'd like to share? Bente, Luisa, Maria, or Marie?
Yes, we want to comment on something, Louise.
Yes, it's just to complement what Marie was explaining about the Youth Caucus. I just want to make sure it's clear that this is, apart from being a great opportunity itself, it's actually also something that is linking to our global dialogue meeting, which, each year the GCM is organizing a global dialogue meeting with 200 to 300 stakeholders from governments, the UN system and NGOs, academia, and so forth. And this year it will be about how governments can promote policy coherence among different spheres of policymaking that have a bearing on NCDs. And this is where our conversation with Marie started for this Youth Caucus, because we saw a good opportunity to start the conversation early on with the IFMSA members. So the idea is that these caucuses, there will be others in other regions, and normally they are tied to an existing meeting. It could be IFMSA, it could be the World Economic Forum, as we've done in the past, and so on. So these are in the making, but normally the caucuses will be feeding into the global dialogue conversation, either by a written statement or by having a representative coming to the meeting and sharing what was discussed at the caucus. And I think your topic is very relevant to policy coherence, because if our future doctors are not equipped to address the real burden of NCDs and the reality of NCDs, then there is some incoherence that needs to be corrected. So just want to make that linkage to the global level.
Thank you.
Yeah, thank you, Luisa, for the clarification. I think we'll definitely take it into account so that also this Youth Caucus doesn't stop here, and that we can further sort of complement this work to the global dialogues that will be organized. Yeah, Marie, you wanted to say something?
I also just want to say that I forgot to mention it, and I think it's a really important point that this is not only an advocacy document for us, but it's also something that will be, as Luisa said, presented or passed on to other actors within the NCD community. And I think it's a great opportunity that we have, and it will also be kind of a tool for us to collaborate with other stakeholders and other NGOs, that we can say, okay, for 2018 we really think that these XYZ is important for medical students, or we are really concerned about these issues. So that's one more thing that I wanted to add about collaboration and the use of the outcome declaration. I think we have a question, Skander.
Yeah, where is it?
It's on the do you want me to just read it?
Yeah. Please.
Yeah. So it's hi, greetings from Lesouk, Algeria. My question is how to send the story. So I guess this is the communications campaign.
Yeah.
Do you want
to reply, Marie?
I think we can.
Okay, so it's basically going through the link that I shared, and I will further share it together with what Luisa explained. Is that there's a platform where you can directly submit a picture and your story, but also since we are planning this for the photo booth and the IFMSA sort of NCD Youth Caucus, you can also share it directly with me, so at lph@ifmsa.org, so that we can also, I don't know, kind of printed or have sort of tried to showcase it at the March meeting. So yeah, this is basically it. Are there other questions, Marie? As I don't seem to.
No, I think there are no further questions. We got a smiley from Omar who sent a question.
Okay, so I actually have a question to Bente Luisa, if you don't mind. So we've seen that there's a need for multi-sectorial action, and the GCM coming from the WHO seems to sort of start the focus from the health sector, but there's definitely a need for sort of increasing the collaboration with other sectors, and seeing the opportunity that we have at the high-level meeting of the UN by 2018. How do you see that we can use this opportunity to further increase this collaboration from the global dialogues and sort of beyond up until the HLM?
So I think that you're doing the right thing. I mean, having this declaration or statement from your General Assembly, I mean, everything that sort of provides inputs and language that can influence the outcome document from the 2018 meeting is important, because this is exactly what will happen. As I mentioned, there will be a report on the progress from the Director General to the SG of the UN during 2017. And then this will be converted to a zero draft document, which will then be called the outcome document from 2018. And this is really the important thing, because this will give us a sort of a marching order. So every time we have outcome documents, which we had in a sense through the political declaration, and also the outcome document of the 2014 UN high-level meeting, this is extremely important. So this is a way to sort of give strategic direction, emphasize on the important thing, like in your case, education, literacy, youth involvement would be very, very important as far as I can see.
If I can add a comment, I saw you had in your, I think it was Marie's slides, there was mention of meaningful participation, youth participation. And it would be, I think you may already know exactly what you mean by this, but make sure you know exactly what you want to achieve. What does it mean, meaningful participation? And I see a shift, which is very positive. At the last meetings I've been to at the UN in New York, youth are not sort of the tokenized youth sitting there as an add-on to a panel. You're actually key actors in a panel. And I think you should have that vision of that being sort of the natural thing, to have an IFMSA voice representative speaking on your behalf at some of these high-level political fora. I think there's growing recognition of this being a natural thing. And you know you have allies among many organizations, including some in the SG's office, like I think Every Woman, Every Child are quite progressive on that. We are as well, I think. And so try to draw on some of the people who are actually willing to put young people in the panel as leaders.
Mm-hmm. And I would add or underscore one thing, that it's very few organizations that in the same extent as you can really sort of focus on education. And I think the results that Marie just pointed at, I mean, it's highly depressing. I mean, it's I graduated in 1987 actually, and I mean what I can hear is that not very much is changed. So how on earth can we be able then to actually implement all the tools that we have developed if the key personnel like doctors are not sort of prepared? So that's, I mean, they are not prepared for NCD perhaps, and they are definitely not prepared to take into account the SDGs. So I think you have a huge possibility and also maybe a responsibility to focus this and also maybe initiate partnerships on this with your colleagues from the midwife, the nurse organizations and so on. But this is only, you know, suggestions. It's up to you, but this is the way you can help the agenda as far as I can see.
Thank you so much. It was really inspiring to hear those recommendations, and we'll definitely try to implement it and take it into account in our further steps of action. Especially that we're sure to have some data that we can use to know how to address these aspects accordingly. I know, Marie, since you can talk about.
Actually, I just wanted to thank Bente and Louise for the encouragement, but also we have another question now. So if there's no more about it. Yeah, it's directed, I think, mostly towards Maho. So this is from Turkey this year, and this is Furkan from Turkey. Hello. This year I'm dealing with the NCD program in our NMO. We have a challenge. We're working about NCDs and risk factors, but we cannot turn a scientific output. Do you have any suggestions for this topic? Maho?
Yes, well, thanks for the question. I believe that it would be important for us to work under the healthy lifestyles umbrella with you. Sadly, I don't think that this is something that we can just say. I believe that is more of a specific case. So I'll be glad to work with you. If you want me to, just drop me an email and we can discuss the projects that you are working. And together we can manage to create a scientific output so we can have numbers and representation out of there. So just drop me an email and we'll work on it.
Sounds great. Thank you, Maho, and thank you, Marie, for reading the questions that I'm unable to find. I don't know if there are other questions. Otherwise, we can just simply conclude. Yeah, very good. So if there are no further comments, I think we can end this meeting, and we're looking forward to having more of your questions and comments. And leading up to the March meeting, we're really happy to have this program organized and having you, Bente, as well with us. So such an honor, and hopefully we'll achieve the outcomes that we're expecting even more.
I'm sure.
Yeah. So with this, we're concluding this meeting. So wishing you a really nice weekend, and
thank you.
Likewise.
Bye-bye.
Bye.
Take care.
Bye.
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 Bye.